Okay, cervical Denneroll class. We're going to start and end with controlled articular rotations. We want to breathe in and irradiate, create full body tension to about 30%. That allows a good working base for my neck to move around. We want to breathe in and irradiate, chin tuck going into full flexion. We're then going to rotate, laterally bend, extend. We're creating the biggest circle possible to our right. We're going to go 4 reps. Search for that best possible space. What movement do you have ownership over? Last rep to our right. Let's now go to our left. Go into full flexion of our neck. Where can we get to? Left rotation, extension, lateral flexion, rotation, and down to flexion again. Slow and controlled. And last rep. We're now ready to use our Denneroll. Our Denneroll traction work. The Denneroll says shoulder this side. We're going to place our Denneroll in this position. Our head's going to go to that opposite side. Our Denneroll wants to be on carpet or yoga mat, a hard surface. I'm going to position the Denneroll at the base of my neck into the lower position. We're going to find my T1 spinous process, that lump at the base of the spine, and then we're going to bring the Denneroll down and traction over the Denneroll. Okay, this would be the position. Now, it's going to be uncomfortable at first as we build up and get that movement back. But over time, this will get more and more comfortable. We want to start off with 3 to 4 minutes, building up to 10-15 minutes per day. If we're pulling up sore, then we decrease that duration. So it's a little bit like braces on the teeth. We want the constant forces to make those changes. So stop the video now, do your assigned amount of time. But when you finish the traction work, what I want you to do is place your hand behind your head, bring your neck up into flexion, and then remove the Denneroll. Stay here for a few seconds before you roll over and get up, making sure you're not too dizzy. Now, what we want to do now is our controlled articular rotations. Okay, we've just done our traction work. Now we need to do a controlled articular rotation to give our nervous system and our muscles some experience in that range that we've just opened up for it. So we want to breathe in and irradiate. We're going to go to our right first of all. Flex, rotate, laterally bend, searching for the best possible space. Does it feel different from when we did our traction work or before we did our traction work? Last rep. Great, then next now go to the left, slow and controlled. Last rep. Okay, now we need to do our segmentation work. So spinal segmentation is where we're moving one vertebra at a time in flexion and extension. So how we do that is we breathe in and radiate, we chin tuck, and then we're moving from the base of our skull all the way down to the base of our neck, one vertebra at a time. So slow and controlled. And we just go into flexion as far as we can, maintaining that chin tuck. As we come up into extension, we'll find an area where we won't be able to go into extension without lifting our chin. We lift our chin and then go into extension. Going back into flexion. And as we come up in the neutral position, we tuck our chin, going down into full flexion. Last rep, full flexion, chin tuck, extend. Way to go, we've done our Denneroll work. This is really important that we start off with our controlled articular rotation, end with a controlled articular rotation, and let's give it a go. Really important if we have abnormal C-shaped curves. This is a really important part of that management plan.